What is the prognosis for bladder squamous cell carcinoma? When we talk about bladder squamous cell carcinoma, or SCC, it's important to understand that this type of cancer generally has a poorer prognosis compared to the more common urothelial bladder cancers. This is largely because SCC is often diagnosed at more advanced stages and tends to be more aggressive in nature. Survival rates for bladder cancer can vary significantly based on the stage at which it is diagnosed. For instance, localized bladder cancer, which means it hasn't spread beyond the bladder, has a 5-year relative survival rate of around 70 to 80%. However, this rate drops sharply when the cancer spreads to regional lymph nodes or distant organs. Bladder squamous cell carcinoma, along with other less common types like adenocarcinoma and small cell carcinoma, tends to have worse prognoses than urothelial carcinoma. This is due to their aggressive characteristics and the fact that they are often detected later in their progression. The depth of tumor invasion and the stage of the cancer are critical factors that affect prognosis. The deeper the tumor invades the bladder wall, or if it spreads beyond the bladder to lymph nodes or other organs, the poorer the prognosis tends to be. High-grade tumors, which are more common in SCC, carry a higher risk of spreading, leading to a worse outlook compared to low-grade tumors, which are generally less aggressive and more superficial. While squamous cell carcinoma of the skin usually has a high survival rate when caught early, bladder SCC behaves differently. It is often more challenging to treat effectively due to its late detection and aggressive nature. Individual factors also play a significant role in treatment outcomes and prognosis. These include the patient's age, overall health, and how well they respond to therapy. Newer treatments and earlier detection methods may improve outcomes compared to historical data, but SCC remains a type of cancer with a relatively poor prognosis compared to other bladder cancers. In summary, bladder squamous cell carcinoma has a less favorable prognosis than the more common urothelial bladder cancers. This is primarily due to its aggressive nature and tendency to be diagnosed at advanced stages. Prognosis heavily depends on tumor stage, grade, and depth of invasion, with earlier detection and treatment offering the best chance for improved survival. Patients diagnosed with bladder SCC requiring careful monitoring and personalized treatment plans guided by healthcare professionals specializing in bladder cancer.